This is about improving and saving people's lives.
Unfortunately, because of the secondhand smoke in the air, I had an asthma attack within 10 minutes, so I was forced to leave.
The cancer and how I got it is due to my exposure to secondhand smoke in all those smoky clubs for all those years.
You're asking the employee to choose between their health and making a living. That's just not fair.
Everybody has a dream. They want to be able to support their family. They want to be able to support themselves. They want to be responsible. But the reality is, if these kinds of things are going to be in your workplace, how can you when you're exposed this way?
I'm grateful to be here today, to be able to say unequivocally that the debate is over. The science is clear. Secondhand smoke is not a mere annoyance, but a serious health hazard that causes premature death and disease in children and non-smoking adults. In the course of the past 20 years, the scientific community has reached consensus on this point.
Millions of Americans are still exposed to secondhand smoke, which contains hundreds of known cancer-causing toxic chemicals. Secondhand smoke can cause disease and premature death, including 3,000 lung cancer deaths and over 46,000 heart disease deaths each year. It is estimated that more than 50,000 deaths are attributable to secondhand smoke each year in the U.S. Indiana is one of the national leaders in smoking and smoking-related diseases. More than 60% of Hoosier adults believe secondhand smoke is a serious health hazard. This concern has led the way for local communities to implement smoke-free air policies across the state. As of February 2007, Indiana communities had passed 30 smoke-free air workplace ordinances, second most in the country.
My vision for Indiana is that every single worker in Indiana is working in a smoke-free environment.
This program explores the complex issues and the political process involved in smoke-free air campaigns. The objective is to discuss successful tactics, common errors, and other sensitive issues that often pit business owners and politicians against local and state public health leaders. Conducting a secondhand smoke campaign is hard work. A successful campaign effort requires a lot of planning and organization with strong coalition support.
Getting people ready for a campaign, there's a lot of planning and a lot of work to do up front. By the time they actually go to the council meetings and start the testimony, they've maybe spent 6, 8, 10, maybe even a year getting the community ready for a policy change, because the elected officials have to see the support of the community. Without a real coalition, this work is just not done. It's done through a coalition, and it's important for them to build a diverse coalition in order to work their work plan.
Planning teams should include hospitality workers, community advocates, faith-based leaders, medical professionals, teachers, youth groups, and business owners.
I think it's important to perhaps spend more time than you think you might otherwise at attracting and recruiting non-traditional partners, so that you get the most diverse range of voices as you can speaking on behalf of the movement. So it's not just people from the hospital or the public health community that are speaking about the importance of this, and so that people are hearing from their minister and others and business owners about why this is important.
We have a lot more people coming into the bar now asking if we're non-smoking than we're smoking. There's plenty of places downtown where you can go to smoke, but there's not that many bars downtown now where you can be in a smoke-free environment, which is nice. People are kind of tired of coming out of the bars, waking up in the morning, having everything smell like smoke, especially the managers. So it's actually quite nice for us.
Before embarking on a campaign for a smoke-free air policy, you must first determine what the current law is in your community. In some instances, there may be laws covering hospitals, governmental buildings, or schools, and of course, there may be no laws whatsoever relating to smoking control. In that case, you will be starting with a clean slate. Establish support for your campaign. It is important to educate and inform the community about the issues. The best way to stay in touch with civic organizations, business leaders, public officials, and the media is to develop a database of contact information.
Well, what we suggested to coalition members was to start from within. Their friends, their relatives, their neighbors, their co-workers who would support our cause, and ask them if they would be willing to be contacted and potentially share information about the tobacco control movement, tobacco control policy development with others. And we just kind of built our infrastructure from there and kind of mushroomed out.
If you're already going to health fairs, make sure that while you're at those health fairs, you're gathering names, addresses, and emails so that you can be in communication with folks. Look for those opportunities where there's a large crowd, you're going to be interacting with a large number of people. Get their names and get them into the volunteer database.
Because our campaign was so long, it was a 2-year campaign, the hardest part of it all was to keep those grassroots members excited and back at the table. So we had to keep kicking it up to keep them motivated. And at our meetings, we had a good grassroots participation because we got the message out over and over and over in a different way each time, through postcards, billboards, emails, that constant communication, that constant database. We had, at the end, 1,000 people that we were actually communicating to about get to the meetings, get to the meetings.
I think probably the most powerful group of people you can have in your campaign, and especially when it comes time to get behind the mic and talk to the city council members or the commissioners, are workers who are working in a place that still has secondhand smoke. And when we were working on amending the Monroe County ordinance to include all workplaces, we had lined up ahead of time a whole group of employees from a local plant that were still on the assembly line working next to the guy who was smoking. And they got up there one after another and basically begged the county commissioners to please pass the ordinance that would make their workplace smoke-free.
We had a restaurant worker, she was a cook in a local well-known restaurant who worked there for 30 years, and the employees would go back to the kitchen and smoke, and she eventually died because of the effect of their smoking. She had a lung disease and she'd never smoked. So her husband spoke at our council.
I don't want smokers to smoke. I don't want you to die. But if you choose to do so, I support your personal choice. But please support mine. Don't take me with you. Don't take me with you.
Before going public with your proposed smoke-free air ordinance, it is important to lay the groundwork by conducting an effective education campaign. This can be costly and time-consuming, but it is critical to the ultimate success of your policy efforts.
We're the people that do whitelies.tv. Okay, it's a lot easier to quit if your workplace is smoke-free, and it also helps children never start smoking. And media advocacy is getting the media to carry your message so you impact on policy. Okay. It's very simply put. Media has power, and media has power to move public policy. It shapes opinions, and the policymakers read that, hear that, see that, and they respond to it. So that's why we have to be in the media.
Live from WLFI, this is Lafayette's News Channel 18 with news from where you live.
West Lafayette City officials consider a smoking ban once again. It's tonight's top story. Good evening, I'm Gina Quattrochi. The West Lafayette City Council is debating a proposed smoking ordinance at this hour. Elliot McInnes joins us now.
Yeah, I think that personal stories tend to be the most powerful and really what the media kind of latches onto.
I believe, with the media, it does begin with relationship, though, and we've heard about that. And so, whether it's with your legislator, it's also with the producer or with the health reporter. Everybody at the local communities need to know who your reporters are, who the newspaper editors are.
The media can be your best friend or your worst enemy in these campaigns. It's just so important to, once you get started, once you're in the initial stages of a campaign, to reach out to your local media, know who they are, go out, maybe try to grab a cup of coffee with them, but make sure that relationship stays intact.
In an ideal situation, you'd want to organize a couple of different spokespeople who might be able to be called on short notice, because there are the same kind of stories that get reported all the time. And so setting that up ahead of time will save the reporter a lot of work, and the more we can do to save the reporter work, the more likely we are to have the story covered the way we want it covered.
When you can't get your story out, that's where, paid media can be used. You can couple paid media together with your earned media advocacy in a nice way to make your message even broader.
Spend an adequate amount of time and money to educate the public on the health hazards of secondhand smoke. This campaign can also expose the deceptive tactics and the false claims used by the tobacco industry to defeat any proposed law.
Okay, let's now list the common tobacco industry tactics.
First of all, it's the tobacco industry mobilizes front groups and local third-party allies to present their message and to be a credible local carrier of what the tobacco industry wants to have said locally. Secondly, it's misinformation about the economic impact or the rights issue or slippery slope or the skewing of the well-known science. And then thirdly is political and legal threats to try to scare the policymakers and convince them to not adopt this sound smoke-free air policy.
Fundamentally, the tobacco industry is going to try and bring conflict into the issue. We know that smoke-free is the only thing that works, and we know that the majority of the community wants it. So the only way that they can overpower you is to make it feel like this has a lot of conflict, this is going to be hard for politicians to do, it's going to be painful, it's going to make people mad, because that makes it harder to achieve anything we want.
It is vital to know and understand the public opinion and the level of support for a smoke-free air ordinance. You may need to sponsor a community survey poll to determine the level of public support you have for a smoke-free ordinance.
We do not only database gathering, but we also conducted surveys there. And we've used that as support basis when we go before the county commissioners to submit information to them.
Most polls will show strong community support and that people generally are in favor of a comprehensive smoke-free air ordinance. This information is also the best ammunition you will need when you approach legislators with your proposal.
We should take the most direct action possible to bring down the second highest rate of smoking in America. Let me just tell you something I'm really sure of. There are the votes in this building to pass this plan. There are.
It's my personal opinion that legislatures have no business implementing government regulations on an independently owned business on a legal commodity, period. This is private property. I set the rules. I set the rules. They don't. If they don't like my rules, then capitalism will dictate whether they come into my establishment or they go elsewhere based upon a smoking principle. This is freedom of choice.
I've gotten the personal choice, the right to smoke argument, more times than I could possibly count. And the simple fact is, we're not telling people that they can't smoke. We're just saying you don't have the right to expose someone else to secondhand smoke, a substance that we know kills.
I think everybody except the most laissez-faire person would say that there's some basic role of government to provide a safety net to protect people from harm caused by other people.
One of my favorite testimonies at a city council hearing was a high school senior last year that brought her government book with her and opened it up to the very first chapter. What is the purpose of government? To protect the health and safety of people. And there was no argument that they could make.
Secondhand smoke exposure causes heart disease and lung cancer in adults and sudden infant death syndrome and respiratory problems in children. There is no risk-free level of secondhand smoke exposure, with even brief exposure adversely affecting the cardiovascular and respiratory systems. Only smoke-free environments effectively protect non-smokers from secondhand smoke exposure in indoor spaces.
Remember, if you find that your community is not ready to support a strong smoke-free air ordinance, then under no circumstances should you try to pass an ordinance, even a weak one.
Well, an important thing when you're working on smoke-free workplace policies is to be clear among yourselves within your coalitions what kinds of policies are effective and what kinds of policies are ineffective. Because there are a lot of ways to be ineffective in the tobacco industry, and their allies that they work with here in Indiana try to promote the ways that are ineffective so that people can continue smoking in the workplace.
Be informed when you are drafting the provisions of the ordinance. It is important to understand and avoid the common mistakes. When the pressure is on, the temptation to compromise will be great.
You have to keep in mind that these people are your opponents. They really in their hearts don't support what you're doing. And there has to be a line of demarcation that you just won't cross. Sure. I'll help you here, I'll help you there, but is that really taken away from what our mission and our objective is by them using us to work against our own selves? We have to be very careful on how far we'll go. Sometimes we go too far.
Business owners and legislators will want to negotiate special provisions like ventilation, smoking rooms, minors provisions, trigger schemes, etc. Please be clear, these compromises are not acceptable. A weak ordinance containing these provisions does not help protect the public from the danger of secondhand smoke. Set guidelines for your planning team up front and agree on what will be considered deal breakers.
It's really important to very thoroughly understand why these things are deal breakers, so that you can clearly articulate to the people on your team and others the reasons why we don't want to go down this road, because they seem like compromises. And it seems like in the political process, that's what you do. You compromise and you make success and then you move forward. Well, in these cases, they're deal breakers for a reason, and people need to clearly understand that if you pass